This session on the gluteal region will cover the 4 superficial muscles.
Hello, my name is Richard Fernandez. I'm one of the anatomists out at La Trobe University's Bundoora campus, and I'll be presenting a clip on the gluteal region.
The 4 superficial muscles of the gluteal region are tensor fasciae lata, gluteus maximus, gluteus medius, and gluteus minimus. Here we can see tensor fasciae lata. You'll notice it's anterior, and you'll also see that it attaches from the anterior superior iliac spine, part of the iliac crest, and inserts into the iliotibial tract. Now, because the iliotibial tract is continuous with the fascia lata, when this muscle contracts, it tightens up the fascia lata. When the fascia lata tightens up, it allows the muscles within the thigh to contract more efficiently. Regarding actions of tensor fasciae lata, as for movements, tensor fasciae lata can act as an agonist. It helps tighten up the iliotibial band and stabilize the knee so gluteus maximus can act in extension. If the other hip flexors, iliopsoas, is damaged, tensor fasciae lata acts as a very weak hip flexor. It's also a very weak abductor and medial rotator. Now, before we go on to the other gluteal muscles, I'd like to give you an analogy to the 3 bears. If you watch bear documentaries, you'll realize that the papa bear, the male bear, usually hangs out by himself. So, I've likened gluteus maximus to the papa bear. This papa bear hangs out by himself, does all the work by himself. Similarly, gluteus maximus acts alone. It's a major extensor of the hip joint. On the other hand, the mama bear and baby bear, they usually hang out together, they work together, and they even feed together. So that's a good way of remembering that gluteus medius, aka mama bear, and gluteus minimus, aka baby bear, work together. They have a common action of abduction and medial rotation. The other thing to consider is, when you think about the bears sharing food, usually they'll have the food between them, and that's how the neurovascular supply to the gluteus medius and minimus muscles present. The neurovascular bundle is located or sandwiched between gluteus medius and gluteus minimus. So, let's start with gluteus maximus. Here you can see it's the largest gluteal muscle and it's superficially located. You can see how fibers are blending with the iliotibial band and deep fibers inserting into the gluteal tuberosity. Its origin is part of the iliac crest, posterior superior iliac spine, sacrum, and of course those deeper ligaments, sacrospinous and sacrotuberous. Here we can once again see the 2 parts, superficial and deep, of gluteus maximus, and we can also see the fold. This image on the right shows the separation between the superficial part and the deep part. When you're in the wet labs, try and notice the 2 parts of gluteus maximus. Here you can see the superficial part blending with the iliotibial tract, and you can also start to appreciate the iliotibial tract attaching to the lateral intermuscular septum, which in turn is attaching to the linea aspera of the femur. Now, as I've been mentioning several times, gluteus maximus is a very powerful extensor at the hip joint. This is so because a lot of the muscle bulk crosses that joint posteriorly. We use it a lot in walking to propel the trunk anteriorly, but we also use it a lot when climbing and standing up from squats. Gluteus maximus is also a very powerful lateral rotator of the thigh, and this is due to a large chunk of it crossing obliquely. Now, it's these oblique fibers that not only insert into the gluteal tuberosity, but the iliotibial tract, that also help with lateral rotation. Gluteus maximus is also a very strong anti-gravity muscle that helps a lot, particularly when contracting eccentrically. For example, when we're sitting with our thighs flexed, gluteus maximus can contract eccentrically to hold our trunk up if our trunk is falling anteriorly into a flexion. It's also a very good postural muscle that helps support the trunk in relation to the pelvis, both when standing and sitting. The nerve supply of gluteus maximus is via the inferior gluteal nerve. And a good way of remembering this is to understand that because gluteus maximus descends more inferiorly than the other gluteal muscles, it should have the most inferior nerve supplying it. There's dual arterial supply for this muscle. Because it's so large, it's supplied by the inferior gluteal and the superior gluteal artery, and is drained by the veins of the same name.
So here I'm going to demonstrate the action of the gluteus maximus muscle. On the skeleton, which you'll notice to be a lateral view, you can see superiorly the iliac crest, laterally the greater trochanter of the femur, posteriorly the sacrum, and inferiorly the ischial tuberosity. Here, I've replicated the iliotibial tract with some masking tape. Notice it's lateral to the hip joint. Over here, I've replicated gluteus maximus muscle with some coloured masking tape, and you should be able to see the two parts of it. Here is the superficial part inserting into the iliotibial tract, and here is a representation of the deep part inserting into the gluteal tuberosity of the femur. What you must notice is that this muscle is located posterior to the hip joint. As such, it would be a very powerful extensor. So here, I'm showing you how gluteus maximus muscle would extend the hip joint.
Now if we move on to gluteus medius and minimus, we can appreciate how these muscles are located deep to gluteus maximus. On this diagram here, gluteus maximus has been cut. You can also see the outline of the sacrotuberous ligament. If I draw your attention to the iliac crest, you can see gluteus medius muscle. Notice that it's attaching to the alar or wing of the ilium, and it's descending down to insert into the greater trochanter of the femur. Here you can see piriformis. Please don't get this muscle confused with gluteus minimus. If we move to this diagram on the right, here we can see gluteus medius, which has been cut to expose gluteus minimus. You can see here gluteus minimus also inserting into the greater trochanter of the femur. There is tensor fascia lata, a bit more anteriorly. Now I should point out that you can see how gluteus medius and minimus cross the hip joint laterally, but some fibers of these muscles also extend anteriorly to the anterior facet of the greater trochanter. It is those anterior fibers of gluteus medius and minimus that allow medial rotation of the hip. Here we can see that in more detail. The posterior and anterior gluteal lines showing the attachment or the origin of gluteus medius, and between the anterior and inferior gluteal lines you can see the origin of gluteus minimus. We covered the actions of gluteus medius and minimus, but it's also worth noting some of the recent research that's come out regarding these muscles. Here you can see the posterior and oblique fibers of gluteus medius. It's the orientation of these oblique fibers inserting into the posterior part of the greater trochanter that allows gluteus medius to perform lateral rotation. It's important to note that if you're specifying actions of this muscle, you should go to the extent of indicating the fibers that perform those actions.
Here I'm going to demonstrate the actions of gluteus medius and gluteus minimus muscles. First of all, you can see gluteus minimus attaching from the hip bone to the greater trochanter of femur. Note some of those fibers going to the anterior facet on the greater trochanter. Now I'm going to apply gluteus medius. You can see it is superficial to gluteus minimus, also attaching to the greater trochanter. You should note that the tendon of both these muscles are crossing the hip joint laterally. Therefore, they would make very good abductors, which I'll demonstrate. So here you can see abduction. The other action is medial rotation.
Quite importantly, they actually help stabilize the pelvis during walking. They do this by working on the contralateral side. In this diagram, we can see the action of gluteus medius and minimus when supporting the unsupported side of the pelvis. Here you can see when both limbs are planted, the pelvis is fairly level. However, when we lift up a limb, the pelvis is going to drop on that same side, on the ipsilateral side. Here you can see the gluteus medius and minimus muscles contracting on the opposite side, thereby lifting up the unsupported side and leveling the pelvis. There are some conditions that would result if these muscles do not perform correctly, and they'll be covered in a later session on the gluteal region. Their nerve supply is a superior gluteal neurovascular bundle, and it's easy to remember that because compared to gluteus maximus, gluteus medius and minimus insert more superiorly, hence superior gluteal nerve, artery and vein. At this point you should stop and perform the activity on the next couple of slides in the worksheet. I've also included a flag race that you can test yourself with.
Note flag A, B, C, and D.
This concludes the session on the superficial gluteal muscles. The next session will look at the deep gluteal muscles.